Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back, everyone. Thank you for listening here at Policy and Rights, and we're going to give start off with a COVID-19 update. Matter of fact, most of the show is going to be dedicated to COVID-19 and what is actually happening, not only around the world but back here in Canada and specifically British Columbia, with being the WHO or World Health Organization upgrading everything to officially being a pandemic. There's going to be a little bit about what is happening in the U.S. with a national emergency, and we're going to talk about what's happening with Prime Minister Justin Trudeau, as well as bringing it back to Dr. Henry giving us best advice and updates on what is going on here in British Columbia. I will tell you this much, though. There is a senior complex where I actually do some work, and I have to enter into that complex every day. As a visitor or as a volunteer, I was denied access to that building until further notice, due to they wouldn't necessarily make a statement about that they had a case within the complex for COVID-19, but it was a statement of prevention of people coming in with the COVID-19. So the place is essentially on lockdown, and there's a lot of that going on around where businesses are canceling events. They are allowing more and more people to telecommute or work at home rather than reporting to an office right away. All this is in hopes to curb the spread of the virus. So certain things with gatherings, sports events, things like that will help curb the virus, the spread of the virus. And we need to actually look at what really is going to help curb the spread of the virus and not go overboard with other things that some people are doing. So with that, let's start off with Dr. Tetris and the World Health Organization and their his latest update and statement to the world. Okay, so here we go.
Thank you, Tariq, and good afternoon, everyone. I want to start today by acknowledging that even though COVID-19 has captured the world's attention, there are still many other health issues people continue to face every single day, and that WHO is continuing to work on. Babies are still being born. Essential surgery is continuing. People still need emergency care after road traffic crashes. People still need treatment for cancer, diabetes, HIV, malaria, and many other diseases. And for all of this, we need health workers. Today, I want to send a personal and sincere thank you to every health worker around the world, especially nurses and midwives, who we are celebrating this year through the International Year of the Nurse and the Midwife. You do a heroic job. We know that this crisis is putting a huge burden on you and your families. We know you're stretched to the limit. You have our admiration. our respect, and our commitment to doing everything we can to keep you safe and enable you to do your job. More than 132,000 cases of COVID-19 have now been reported to WHO from 123 countries and territories. 5,000 people have lost their lives, a tragic milestone. Europe has now become the epicenter of the pandemic, with more reported cases and deaths than the rest of the world combined, apart from China. More cases are now being reported every day than were reported in China at the highest of its epidemic. At the height of its epidemic. I will repeat this one. More cases are now being reported every day than were reported in China at the height of its epidemic. We're encouraged that many countries are now acting on the 8 pillars of WHO's strategic preparedness and response plan. Most countries now have a national plan. Most are taking a multi-sectoral approach, and most have laboratory testing capacity. WHO has evidence-based guidance that every country can use according to each of the 8 pillars. And we're continuing to support countries to prepare and respond. We have shipped supplies of personal protective equipment to 56 countries, and we're shipping to a further 28 countries. And we have sent almost 1.5 million diagnostic tests to 120 countries. Our message to countries continues to be, you must take a comprehensive approach. Not testing alone, not contact tracing alone, not quarantine alone, not social distancing alone. Do it all. Any country that looks at the experience of other countries with large epidemics and thinks that won't happen to us is making a deadly mistake. It can happen to any country. The experience of China, the Republic of Korea, Singapore, and others clearly demonstrates that aggressive testing and contact tracing combined with social distancing measures and community mobilization can prevent infections and save lives. Japan is also demonstrating that a whole-of-government approach led by Prime Minister Abe himself, supported by in-depth investigation of clusters, is a critical step in reducing transmission. WHO has clear advice for governments, businesses, and individuals. First, prepare and be ready. Every person must know the signs and symptoms and how to protect themselves and others. Every health worker should be able to recognize this disease, provide care, and know what to do with their patients. Every health facility should be ready to cope with large numbers of patients and ensure the safety of staff and patients. Second, detect, protect, and treat. You can fight a virus. You can't fight a virus if you don't know where it is. Find, isolate, test, and treat every case to break the chains of transmission. Every case we find and treat limits the expansion of the disease. Third, reduce transmission. Do not just let this fire burn. Isolate the sick and quarantine their contacts. In addition, measures that increase social distancing, such as canceling sporting events, may help to reduce transmission. These measures, of course, should be based on local context and risk assessment and should be time limited. Even if you cannot stop transmission, you can slow it down and save lives. And fourth, innovate and learn. This is a new virus, and a new situation. We're all learning, and we must all find new ways to prevent infections, save lives, and minimize impact. All countries have lessons to share. There are simple, effective things we can all do to reduce the risk of infection for ourselves and those around us. Clean your hands regularly with an alcohol-based rag or soap and water. Cover your mouth and nose with your elbow if you cough or sneeze. Stay home if you're sick. Avoid unnecessary travel and large social gatherings. Comply with the advice of your local or national health authority. Find and share reliable information. And finally, you can give. Together with the United Nations Foundation and the Swiss Philanthropy Foundation, WHO is today launching the COVID-19 Solidarity Response Fund to enable individuals and organizations to contribute. Until now, we have been relying mainly on governments to support the response. We thank all those countries who have supported WHO's strategic preparedness and response plan, including Japan, which this week contributed $155 million. Now everyone can contribute. Funds raised will be used to coordinate the response, to buy masks, gloves, gowns, and goggles for health workers, to buy diagnostic tests, to improve surveillance, and to invest in research and development. To give to the COVID-19 Solidarity Response Fund, go to who.int and look for the orange Donate button at the top of the page. We thank Google, Facebook, and the individuals who have already contributed. Every dollar donated is a dollar toward saving lives. We're all in this together. I thank you.
Okay, so we have to thank the WHO. They're doing a lot of really hard work to joining people around the world so that we can tackle COVID-19, and of course, as Dr. Tedros said, other conditions. There are other things out there that they also need our attention. While this pandemic is still ramping up. So confirmed numbers globally, we're at 142,539 confirmed cases, which 9,769 of them are new. We have 5,393 deaths with 403 new deaths. I would say, 438 new deaths. In China, they are at 81,021 confirmed cases, 18 of them being new, and 3,194 deaths, 14 new deaths. Outside of China, the breakdown would be 61,518 confirmed cases of COVID-19 and 9,751 of them being new. Notice that the new global number of new cases is almost matching the same as outside of China, which kind of makes sense if Europe is our new epicenter for this disease. Outside of China, there are 2,199 deaths, 424 of them being new. Again, look back to our global figures again, and we'll see that the numbers are almost matching again. So, There are 135 countries, territories, and areas reporting that they have cases of COVID-19, which 13 of those are new areas reporting this. There are things that, of course, the global health workers are actually needed to help protect them and protect others while they are trying to treat people with COVID-19. And let's look at that, where 89 million masks are needed. 30 million
the show
gowns
has been produced by Depictions Media.
Please
contact
1.5
us at depictions.media
million
for
goggles,
more information.
76 million gloves, and 2.9 liters of hand sanitizer. There is a extreme importance in actually curbing this disease, which everybody's going back to, of course, hand washing. So we got to make sure that as we're doing things, we do meet and greet with people, that there's hand washing involving that. One of the other things is making sure that we sneeze into a cloth, the crook of our arm, something like that, so that we're not sneezing on other people or coughing on other people. So that is another important thing in lines of etiquette if you are actually in public places. So let's move on to some of the things that are happening here in Canada with COVID-19. And we'll see that there are 193 total cases of COVID-19 in Canada, with British Columbia having 64, Alberta 29, Manitoba has 1, Ontario has 79 cases, Quebec with 17, New Brunswick 1, and there are some other repatriated travelers that also are included in those numbers. Okay, let's get back to what is going on with the federal government versus this particular outbreak.
Upon my doctor's recommendation, I will remain in self-isolation for 14 days. I want to be clear, I have no symptoms, and I'm feeling good. And technology allows me to work from home. Of course, it's an inconvenience and somewhat frustrating. We are all social beings, after all. But we have to do this, because we have to protect our neighbors and our friends, especially our more vulnerable seniors and people with pre-existing conditions. I know that you're worried. You're worried about your health, about your family's health, about your job, your savings, about paying rent, about the kids not being in school. I know that you're concerned about uncertainty in the global economy.
So the government is
working to stop the spread of the virus. Businesses and citizens are taking precautions. We have outstanding public health authorities who are doing an outstanding job. We will get through this.
Then the bank
should have to worry about paying rent, buying groceries, or additional childcare because of COVID-19. We will help Canadians financially. Of advice I've gotten from medical professionals, it was explained to me that as long as I do not show any symptoms at all, there is no value in having me tested.
Okay, so our Prime Minister Justin Trudeau is offering us assurances that the Canadian government is doing everything that they know how to do and keeping keeping it safe. They're handing us the best advice according to science, including using Justin Trudeau and his family as an example, with his wife actually having COVID-19, that they are self-isolating while she is in quarantine. So we wish Mr. Trudeau and his family all the luck and science that goes along with that, to healing his wife from this condition. Okay, back to some of the things around the world. With as you know, Italy has closed its borders. There's been several other European countries, like the Czech Republic, closing borders to Germany, and with Europe being the new epicenter, and we have heard how Italy has just been hit really hard. Within days, malls are emptied, and people are just simply not going out, because, well, going into public places might be a little risky. Staying at home, being with family, may be the safer bet during this pandemic situation. So let's listen a little more about what in this next clip about what might be going on in Europe and Italy. Okay.
Want to show you some live pictures of a piazza in Naples in the south of Italy. A piazza on a beautiful day in the south of Italy normally would be bustling at this time, early afternoon. Not so today, because it's no longer just the north. It is all of the country of Italy now affected by a lockdown, ordered by the Prime Minister Conte, saying that really it's a matter of taking strong measures to save the country for the future, essentially, is how he put it, in announcing what are the most stringent quarantine and lockdown measures that we've seen outside of China. There are Canadians affected by these new rules. You met one on the weekend, but we wanted to touch base with her now that things have changed. Claire McCarville, from Winnipeg originally, working as an au pair in northern Italy since just January, and all caught up in this story now. She's back with us. She was a guest with Jennifer Hall on Sunday, but in case you missed that conversation, I wanted to meet Claire and update her situation. So Claire, thanks for coming back. Nice to see you this morning with us.
Yeah, of course. Love to be here.
So, well, probably not love to be in the situation you're in, I'm guessing.
Very true,
because not only were you affected when you were in the north before by the lockdown of the north, but now the whole country. So what is your reaction, I guess, hearing that the Prime Minister has shut down all of Italy?
It is extremely concerning. So basically, before this small ski village that I was staying in wasn't inside the quarantine zone. And then now that the announcement came yesterday, we are now our little town is directly inside of the lockdown. So it definitely affects our daily activities and stuff. So it's a lot to process for sure.
Well, I bet. You never would have anticipated that when you signed up to be an au pair and started in January. Exactly. Anybody who missed the conversation you had on Sunday, if I get this right, you were to be in Milan, but that was affected by the lockdown. So you went with your au pair family up into this ski village of Champoluc, which was not affected, but now it is. So now that you're all in this situation, what's the discussion there within your family and with you?
Yeah, so basically we're just trying to get along with our daily lives, sort of keeping the kids up to date with, since they're not in school anymore. So my main job is helping them with homework every day. Luckily, being in the small village that we are still allowed to go outdoors because there's really nobody walking around at all. So we are still able to go outside for walks. In a lot of the larger cities like Milan, Rome, Naples, they aren't allowed because of the massive population there. They're trying to keep everybody indoors. So we are lucky that we still get to go outside, get some fresh air, sort of get some energy out. It's very helpful for sure.
I bet. You're not totally cloistered, but is there, you said it's pretty quiet. Is there anybody there in the village? I mean, is the ski hill running still, or is that all shut down too?
They shut down all of the ski lifts official yesterday. So luckily we got our last ski over the weekend. And then, all of the tourists pretty much have gone home. It's mostly just people who are staying out here to either stay away from the larger cities or people who live out here permanently.
Are you reaching out? I'm wondering about your future. I mean, are you talking to Canadian consular officials or anybody at Canadian Embassy about your situation and getting out of it at all, Claire?
Yeah, so pretty much the situation right now for me personally is because when we left Milan, we were just planning on coming out to this village for just a quick week to do some skiing and stuff. And then all of the lockdown got imposed. So a lot of my travel documents, a lot of my belongings are still back in Milan. So right now, my main priority is figuring out how I'm able to go retrieve my stuff and try to hopefully get away out, yeah.
Travel documents, including passport. You're without that, as
Correct.
I understand.
Yeah.
So that's a big complication. Are you finding them helpful? I mean, have you had good conversations for help?
I pretty much, they're very busy over the phone, very hard to contact, which is understandable given pretty much everything going on in Europe right now. But I've been getting some emails, been trying to there's also a lot of other au pairs that are in the same situation, a lot of other Canadians. So we've kind of been talking with each other to discuss what the best plan of action is.
So what have you been sharing? What are those conversations like?
Pretty much how we've been talking with airlines for sure, trying to, because some flights have been canceled, some flights haven't. If we're going to be quarantined when we get home, what the situation is, because for us getting back to Canada, there aren't any direct flights from anywhere in Italy to get back to Canada. So our situation is having to fly out of Italy to get to perhaps Paris or to get to London in order to get back to Canada.
So it's pretty much a sharing of information and helping each other through all of this. In the meantime, I'm sure you're in touch with your family in Winnipeg. Not sure if they're up extra early this morning to watch our conversation. But how are they? They've sent off their daughter off for this incredible experience being an au pair in the north of Italy, and you find yourself in the middle of this. How is your family feeling about all of this?
Yeah, so we've had very good contact, communication every single day, keeping each other up to date on the situation. They're obviously very concerned about how the virus is affecting everybody here, because right now, obviously, it has been in Canada, Winnipeg, no cases, so they're luckily very, very calm over there. But here it's been a bit more difficult. So they have been in good contact with my host family here, sort of discussing what the options are and trying to keep each other in very calm and composed.
Well, you sound very calm and composed, even being in the midst of really quite an unprecedented situation with the whole country locked down. Is that really a reflection of how you're doing, Claire, or as this gets more intense, are you starting to become more concerned, maybe?
For sure, yeah. Like every time a new situation comes out, for example, last night was definitely pretty tough, sort of hearing the news about the entire country. But I mean, there's really no point in getting crazy and panic because it's just going to make the situation worse. It's better to just, stay calm, go through things rationally, and hopefully be able to find solutions as quickly as possible.
And go for a walk to just calm things down, I guess, if that's all you have to do. Listen, we'll stay in touch, Claire. Hopefully this will be coming to a quick end for you and you get home safe and sound. But thank you very much for the time this morning again.
Yeah, of course. Thanks for having me.
Claire McCarville, who's there in the tiny ski village, no longer where they're skiing, of Champoluc in Italy. North is west of Milan, and she, one of many Canadian au pairs and Canadians caught up in this Italian lockdown situation. In Spain, after a surge of infections. In Europe, it is the second to Italy for COVID-19 cases. Spanish officials warn the infection rate could more than double to 10,000 by next week. The Czech Republic also declaring a state of emergency. It is closing its borders to travelers crossing from Germany and Austria. Austria is following Italy, closing all shops except grocery stores, pharmacies, and banks beginning Monday. Germany, meanwhile, is reassuring people with an economic pledge, €500 billion to support Europe's largest economy. In France, public gatherings are limited to 100 people. The Louvre, Eiffel Tower, and several other historic attractions are closed. The Queen cancelled 2 upcoming public appearances. Buckingham Palace says other events will be reviewed on an ongoing basis. Crystal Gamansing, Global News, London.
Okay, we should thank Global News for that report. In Europe, so a lot going on around the world as far as COVID-19 is concerned, and again, if we keep we act wisely and we do things in a smart fashion, and we all work together to we will actually be able to see the numbers go down and end to this particular virus. Okay, let's move on to something that Dr. Henry said from British Columbia. She is the lead doctor for British Columbia. Okay, while we get that.
Thank you very much. My name is Adrian Dix. I'm BC's Minister of Health. Beside me is Dr. Bonnie Henry, our Provincial Health Officer. We're honored to be here on the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nation, and I wanted to introduce Dr. Henry.
Thank you, and thank you very much. Much has happened in the last 24 hours, as I'm sure you're aware. I do want to start by talking about our new cases, and we have 7 new cases to report today, so our total in British Columbia as of earlier today is at 53. Most concerning for us is the fact that we do now have a second long-term care home that has an outbreak that is involved with COVID-19. This was an outbreak, as you are aware, it's the end of our influenza season, and we have been having influenza outbreaks in long-term care homes, as we expect to see during this season. And this one was thought to be an influenza outbreak as well, and it turns out that one of the residents who was tested, out of a number that was tested, a man in his 90s who's a resident of Hollyburn House in North Vancouver, tested positive for COVID-19. And in addition, it was apparent that a number of the healthcare workers at that facility were also linked to the Lynn Valley Care Center. And so we have 2 additional healthcare workers who have worked at both of those facilities who've been identified through the outbreak at Hollyburn House. And they are a man and a woman, both in their 40s, and they're both in isolation at home in the Fraser Health region. So obviously we are continuing the investigation both into the Lynn Valley Care Center and now the connections with Hollyburn House. And we talked yesterday about the fact that we do have many people who work in many different facilities, and that has been part of the investigation to track down. So these investigation and the investigation of the second outbreak, which was thought to be an influenza outbreak, converged with the understanding that this was COVID there as well. We are, of course, continuing the investigation into all of the healthcare workers, and I know there's been more testing that's happened at the Lynn Valley Care Center, and additionally there's been a number of other residents who tested negative for COVID-19 at Hollyburn House at this time. We have another 4 cases who are in the community, all of them in Vancouver Coastal Health. 3 of them are travel-related. One, a male in his 40s who traveled to the UK, primarily London and Scotland. And we have a couple in their 40s, a male and a female, who are additional cases who were on a travel to on a tour and a cruise on the Nile in Egypt. So that again increases the number of people in our province who have been associated with travel to Egypt. I think, obviously we're continuing to monitor. Sorry, we have one additional male in his 50s who we have not yet determined the source of his where he picked up COVID-19. So he is another of our community cases, and he is in the Vancouver Coastal Health Region and is in stable condition at home in isolation. We remain at one person right now who's in hospital, a woman in her 60s in Fraser Health, as we mentioned yesterday, and she is in stable condition. And on a positive note, we have 2 more of our cases who are fully recovered. So we now are up to 6 of our 53 cases who have met the criteria, both of symptoms and have testing that means they're no longer infectious to others, as far as we know. So many things have changed in the last 24 hours, and I know you're aware of things that have happened globally, the issues that have happened in our neighbors to the south in particular, and it's become apparent that this is a rapidly changing situation again, and the risk for us in British Columbia, while it hasn't changed a lot here in BC, the risk has increased all around us, I would say, and our understanding of the situation has also changed. So there are a number of things that we have been discussing today, and measures that we feel are appropriate at this time that will be taking and announcing today. In particular, we are advising British Columbians against all non-essential travel outside of Canada, and that includes the United States. I think this is really important. It is clear at this time that the evolving situation, both in the United States and globally, is a risk for all of us, and we are strongly advising people not to travel. If you do travel, anyone who chooses to travel outside of Canada will be required to stay away from work or school for 14 days on their return. We feel that this is the appropriate measure at this time, given the situation that we've been seeing, given the importation of travel-related cases and the challenges that we have in monitoring them. I will also say that we had many conversations today with my colleagues across the country, and the situation, particularly in Quebec, which has just come off their March break, where they had a lot of travel of students and others to France and other places in Europe, where, as you know, the outbreak has really exploded in many countries there. While I have full confidence that it will come under control, the situation is just too risky right now. And for people who feel that that is a risk they're willing to take, that is their decision. But we need to be able to ensure that our schools and our workplaces remain safe here in British Columbia now. The other thing that has become apparent is with the increasing transmission of COVID-19 at mass gatherings and events, and we've heard of many of them, including one's large event in Toronto where people might have been exposed. We had a person who became ill while at a large conference here in Vancouver, and that was concerning to people, even though the risk is very low. With the escalating risk of this community transmission, we have to do our best to slow this COVID-19 infections here in British Columbia and to protect people in our communities. So we are directing all event organizers in British Columbia that they will be required to cancel any gatherings larger than 250 people. And 250 people is not scientific. We talked a lot about what are we talking about. Why wouldn't we go with 1,000? And that's what's been used in some places in the U.S. and some places in Canada and other parts of the world. 250 has also been used, and it's not, again, a scientific number, but it is a number that we think has some rationale to it, in that over that large a group, it's really challenging to put into place those social distancing measures that protect people and prevent transmission of respiratory infections. And those are some of the things that we talked about yesterday, being able to be at least an arm's length distance from each other, having the ability to clean your hands regularly. And so these are the things that we are now saying all of us have to take a part in. And we are looking at event organizers, whether it's community events, whether it's large events, to look at alternatives that they can use to keep that connectedness and the social cohesiveness. And that may mean, in some cases, having events where you can have a smaller number of people, reducing the number of people who come, separating them, making sure that we make allowances and allow for people who are more vulnerable to having severe infection or from dying from this to not attend events, making it easy for people to cancel out of events. And I have heard from many, many event organizers that us making this recommendation makes it much easier for them to take those measures that we need them to take to protect our health. We will be working, so what we aren't saying is that, any building that has 250 people in it should be closed. Although we are telling workplaces now to start thinking about how to increase distances within your workplace or make sure that people can do things like working from home, if that's a possibility, or holding virtual meetings, not coming together, not traveling together. So if we're talking about a Walmart, for example, where there might be 250 people, but you're still able to take those social distancing measures. You don't have to be next to somebody. You don't have to have that close interaction. You are able to cover your cough if you cough. We'll be working with post-secondary schools, with government of BC. We'll be working with the Ministry of Education and others across government to ensure that we can handle these measures within those settings appropriately. We also, at this time, are not taking action. We don't believe it's appropriate at the moment to close schools. They are, as I mentioned yesterday, a place where young people can be kept safe from a lot of things. They can learn about social distancing. We need to understand more about the role of young people in transmission of this disease, and we know that sometimes that the impacts of closing schools, particularly abruptly, can cause a lot of societal disruption and economic impact. So we want to be doing that in a measured way. I also want to say that these are measures for now. They're not forever. These are things that we think are incredibly important for all of us in society to think about as ways to stop this spread, to slow down. You've heard people talking about, I've talked about, flattening the curve so that we can prevent transmission to those who are most vulnerable to severe illness and death in our society. We can protect our healthcare system. We can protect our long-term care facilities from infection. We also recognize that this is our best advice today, and it has varied quite a bit from what I talked about yesterday, and that is taking into account as best we can what is going on around the world, what is going on in our own context, in our neighbors' context. And this is something that we will be reviewing daily. We'll certainly be reviewing our position on schools. We know that March break starts at the end of the day tomorrow, so we have a period of time where we can be thoughtful, we can investigate the issues around schools, we can talk with the stakeholders and make sure they know we know what is the best thing for us to do in the coming days to weeks as the situation continues to change around us. So these actions, as I said, are for now. And we will be reassessing both daily and weekly, and we'll be here to talk to you about those too. I believe these actions are necessary right now to slow down the spread of this disease and to protect the health of our communities and everybody here in British Columbia.
All right, and in the U.S., Donald Trump has declared a state of emergency, which is supposed to bring about $50 billion of aid to each and every state across the United States. All right, which means about $1 billion per state. So, of course, Donald Trump has actually been tested for COVID-19. He was at an event where somebody did turn up with it, and he also made a statement about being tested, and he makes a few statements about testing for COVID-19 in general.
Jordan, appreciate everybody being here. Today I'd like to provide an update to the American people on several decisive new actions we're taking in our very vigilant effort to combat and ultimately defeat the coronavirus. We've been working very hard on this. We've made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible. A lot of that had to do with the early designation and the closing of the borders. And as you know, Europe was just designated as the hotspot right now, and we closed that border a while ago. So that was lucky, or through talent or through luck, call it whatever you want. But through a very collective action and shared sacrifice, national determination, we will overcome the threat of the virus. I also announced Wednesday night, following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days from entering the United States. Citizens, permanent residents, and our families, any of the families returning from Europe, will be subject to extra screening as well as self-isolation for a period of 14 days. As the World Health Organization confirmed today, many of the things that what we said were 100% correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure will save countless lives. I appreciate a number of the folks behind me. Number of the people behind me said that that saved a lot of lives, that early designation. But it is only the beginning of what we're really doing, and now we're in a different phase. We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances. They were there for a long time. They were in place for a long time, and we're breaking them down now. And they're very usable for certain instances, but not for this. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and aside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York. The emergency orders I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulations to give doctors, all hospitals, and healthcare providers maximum flexibility to respond to the virus and care for patients. This includes the following critical authorities: the ability to waive laws to enable telehealth, a fairly new and incredible thing that's happened in the not so distant past. I tell you, what they've done with telehealth is incredible. It gives remote doctors visits and hospital check-ins, the power to waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need. Number two, the ability to waive requirements that critical access hospitals limit the number of beds to 25 and the length of stay to 96 hours. The ability to waive the requirements of a 3-day hospital stay prior to admission to a nursing home, big thing. The authority to waive the rules to hinder hospitals' ability to bring additional physicians on board or obtain needed office space. They can do as they want. They can do what they have to do. They know what they have to do. Now they don't have any problem getting it done. The authority to waive rules that severely restrict where hospitals can care for patients within the hospital itself, ensuring that the emergency capacity can be quickly established. We'll remove or eliminate every obstacle necessary to deliver our people the care that they need and that they're entitled to. No resource will be spared, nothing whatsoever. 10 days ago, I brought together the CEOs of commercial labs at the White House and directed them to immediately begin working on a solution to dramatically increase the availability of tests. Other countries have called us and worked with us, and they're doing similar things or will be doing similar things. As a result of that action today, we're announcing a new partnership with private sector to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently. But we don't want people to take a test if we feel that they shouldn't be doing it. And we don't want everyone running out and taking, only if you have certain symptoms. Using federal emergency authorities, the FDA approved a new test for the virus. We did this within hours after receiving the application from Roche, a process that would normally take weeks. We therefore expect up to 500,000 additional tests will be available early next week. We'll be announcing locations probably on Sunday night. I want to thank Roche, great company, for their incredible work. I'd also like to thank Thermo Fisher. The FDA's goal is to hopefully authorize the application within 24 hours. It'll go very quickly. It's going very quickly, which will bring additionally 1.4 million tests on board next week and 5 million within a month. I doubt we'll need anywhere near that. At the same time, we've been in discussions with pharmacies and retailers to make drive-through tests available in the critical locations identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having to leave your car. I want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine whether a test is warranted and to facilitate testing at a nearby convenient location. We have many, many locations behind us, by the way. We cover this country and large parts of the world, by the way. We're not going to be talking about the world right now, but we cover very, very strongly our country, stores in virtually every location. Google has 1,700 engineers working on this right now. They've made tremendous progress. Our overriding goal is to stop the spread of the virus and to help all Americans who have been impacted by this. Again, we don't want everybody taking this test. It's totally unnecessary. And this will pass. This will pass through, and we're going to be even stronger for it. I had my temperature taken coming into the room.
So did we.
You did? Good.
Yes, sir.
Yes. Let's compare. Do you want to compare?
We did all of it.
Very good. Well, that means we're all looking good. I also took the test last night. Yeah. And I decided I should, based on the press conference yesterday. People were asking, did I take the test?
The result, Mr.
I don't know, whatever it takes, a day or 2 days, whatever it is. They send it to a lab.
Okay, so that's going to be our last clip of the show. But we heard Donald Trump saying that he actually was tested for COVID-19. And we also heard him say that he's going to ensure that the funds are going to be there to make sure that testing of people can be done quickly and easily, giving doctors the ability to do whatever it takes to make people healthy and keep them safe. Unfortunately, we also did hear him downplay the importance of testing overall, which, in one hand, his statement was essentially good, that if you're not symptomatic, as we heard Justin Trudeau say, if you're not symptomatic, you don't need to be tested. You only need to be tested if you're showing symptoms of COVID-19. And I'm going to invite everybody to go to who.int. Let me make sure I'm actually giving to you that correctly. That is who.int, and you should click on the World Health Organization's website to see what the official symptoms are for COVID-19. If you're not showing symptoms, you don't need to be tested. And if you are symptomatic, please do go get tested. And if you've been exposed, you should self-isolate for 14 days to see if you do become symptomatic. Outside of the 14 days, hey, no symptoms, you are probably good. Don't really need to worry about it. So with that, we want to say goodbye, and we will talk to you again next week with more updates from policy and rights around the world. Okay, bye for now.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.